The top 3 vitamins that men should take after 50. As a compounding pharmacist with over 20 years' experience, I've seen firsthand how important vitamins are in helping men over 50 maintain their health and vitality. In this video, we'll talk about the 3 vitamins that I recommend every man over 50 takes daily. Before we get started, please like and subscribe to the channel. It really helps me out. You might be wondering why I chose these 3 vitamins. Well, as a compounding pharmacist, I see many patients who come in complaining of low energy, difficulty concentrating, and a lack of motivation or drive. These are all common issues that men over 50 face, and they can be caused by a number of factors, including hormonal changes, lifestyle stress, and diet. That's why I put together this list of the top 3 vitamins that I believe can help men over 50 live better, healthier lives. And these 3 vitamins are: number 1, vitamin D, number 2, magnesium, and 3, omega-3 fatty acids. Let's take a closer look at each of these. The first vitamin on my list is vitamin D. Now, vitamin D is actually a hormone that your body produces when your skin is exposed to sunlight. It's important for a lot of different things in the body, like bone health, immune function, and even testosterone production. Many people, especially those over 50, may not be getting enough vitamin D from sunlight alone because of several factors. 1. Less time spent outdoors. 2. Changes in our skin like decreased sebum production, which leads to less vitamin D absorption. 3. Aging-related changes in our kidneys and liver that affects the activation of vitamin D. 4. Increased inflammation that makes it harder for the body to absorb vitamin D. And 5. Hormonal changes like lower testosterone levels, which also leads to less vitamin D absorption. So, it's important to make sure that you're getting enough vitamin D through your diet or supplements. Studies show that people who take vitamin D supplements have higher levels of vitamin D and those without. But did you know that taking vitamin D supplements can also improve your mood and reduce symptoms of depression? A study published in the Journal of Affective Disorders found that participants who took vitamin D supplements experienced a significant improvement in their mood and a reduction in depressive symptoms. Another study published in the Journal of Clinical Endocrinology and Metabolism found that low vitamin D levels were associated with lower testosterone levels. This suggests that increasing vitamin D intake may help improve testosterone levels. Some foods that are high in vitamin D include fatty fish like salmon, mackerel, and tuna. But remember, it takes a lot of these foods to get enough vitamin D, so it's often necessary to take supplements. The recommended daily amount of vitamin D for adults over 50 is 600 to 800 international units. However, I recommend taking at least 10,000 international units of vitamin D daily for optimal results. If you're considering taking vitamin D supplements, talk to your doctor first, especially if you have any medical conditions or take medications. Number 2, magnesium. Magnesium is an essential mineral that plays a role in hundreds of chemical reactions in the body, such as helping to regulate muscle and nerve function, supporting a healthy immune system, and maintaining healthy bones and teeth. As we age, our bodies become less efficient at absorbing magnesium through our diets. And this is especially true for men over 50. You see, there are several reasons for this. First, as mentioned before, changes in our skin affect our ability to absorb nutrients like magnesium. Second, low stomach acid. As we age, our stomachs produce less acid, which makes it more difficult to break down food and absorb nutrients like magnesium. Third, hormonal changes, specifically lower testosterone levels, can lead to less magnesium being absorbed in the body. Fourth, increased inflammation. Inflammation in the gut can also hinder the body's ability to absorb magnesium. And 5, certain medical conditions and medications can affect magnesium levels in the body. For example, diuretics, which are commonly used to treat high blood pressure and edema, can deplete magnesium levels. So it's important to make sure that men over 50 are getting enough magnesium through their diet or supplements. A study published in the Journal of the American College of Nutrition found that low magnesium levels were associated with higher rates of depression in older men. Another study published in the Journal of Research in Medical Sciences found that magnesium supplementation improves symptoms of depression in patients with major depressive disorder. Getting enough magnesium can also help improve sleep quality, lower blood pressure, support a healthy immune system, and boost testosterone levels. Some foods that are high in magnesium include spinach, almonds, avocados, and black beans. But again, it can be difficult to get enough magnesium from food alone. That's why I recommend taking a supplement like magnesium glycinate, which is one of the most absorbable forms of magnesium. The recommended dietary allowance for magnesium for adult males over 50 is 400 to 420 millimolars per day. However, I recommend taking 600 millimolars of elemental magnesium daily. Now let's move on to the third vitamin on my list, which is omega-3 fatty acids. Omega-3 fatty acids are essential fats that our bodies cannot produce on their own, so we must obtain them through our diets or supplements. There are two types of omega-3 fatty acids that are important for our health: DHA and EPA. Both are found in fatty fish like salmon, mackerel, and sardines, as well as in microalgae. Omega-3s are important for a lot of things, like brain health, heart health, joint health, and reducing inflammation in the body. Now, as men age, they may start to experience symptoms of low testosterone, such as decreased muscle mass, increased body fat, fatigue, and low libido. Interestingly, research suggests that omega-3 fatty acids may play a role in maintaining healthy testosterone levels. A study published in the International Journal of Impotence Research found that men with low omega-3 levels had significantly lower testosterone levels than those with higher omega-3 levels. This suggests that increasing omega-3 intake may help improve testosterone levels and alleviate symptoms of low T. Additionally, omega-3s can also help improve brain function and memory, support healthy vision, promote healthy skin and hair, and reduce joint pain and inflammation. Now, while it's important to get omega-3s from food, it can be difficult to consume the recommended amounts through diet alone. That's why I recommend taking a supplement. A good supplement will typically contain both DHA and EPA, as well as other omega-3 fatty acids. The recommended daily intake of combined DHA and EPA is 200 to 500 milliliters, but I recommend taking at least 1,000 milliliters per day. So those are the top 3 vitamins that I recommend every man over 50 takes daily. Remember, these vitamins are not intended to be a substitute for a healthy diet and an active lifestyle. They are meant to complement a healthy lifestyle and help ensure that men over 50 are getting the nutrients they need to stay at their best. Again, as a compounding pharmacist, I've seen firsthand the benefits of these vitamins for men over 50. When taken together, they can help improve energy levels, focus, and overall health. If you're interested in learning more about men's health issues, check out this playlist here. And don't forget to like and subscribe to the channel. Thanks for watching.